All right. Hi, everyone. Welcome back to the NNLM Virtual Symposium on Health Misinformation. My name is Erica Lake, and I'm the Medical and Academic Library Outreach Coordinator for Region 6 of the Network of the National Library of Medicine. And I'll be your host for this session. Got just a few technical items to cover before we get started. All attendees have been muted, but we do welcome your comments in the chat at any time. Please be sure to select everyone from the drop-down menu when posting your comments to ensure attendees, hosts, and panelists can all see them. If you have questions specifically for our speakers, please use the Q&A function to ensure that they don't get lost in the chat. We'll queue them up as they come in and save them for our speakers to address at the end of their presentation. We have live closed captioner for this event, and you can access the closed captions by clicking on the icon with the 3 dots and then selecting closed caption. And if you'd like to share on social media, we encourage you to use the hashtag for this event, HealthMisinfoNNLM. All right, before I introduce our speakers, I'd like to share just a few words about who we are. NLM, the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the Network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. And now it's my pleasure to introduce our 3 speakers that we have for this session, how health professionals can leverage social media to combat health misinformation. Dr. Shikha Jain is a hematology and oncology physician and an associate professor of medicine at the University of Illinois in Chicago, as well as the director of communication strategies in medicine and the associate director of oncology communications and digital innovation for the University of Illinois Cancer Center. Lisa Mordell is a second-year medical student at Loyola University Chicago Strick School of Medicine, and Dr. Eve Bloomgarden is an endocrinologist at North Shore University Health Systems and is the director of thyroid and the director of endocrine innovation and education for the Division of Endocrinology. All right, with that, I'm going to hand things over to our speakers now.
Thank you, Erica, for that lovely introduction. As Lisa is getting our slides up, I just want to thank everyone for joining us today. We have a lot to cover, so we're going to go through quickly. To start, we're going to have Lisa start off with a little bit of a background on, oh, Lisa, you doing okay there? There we go. Some technical difficulties to start off this afternoon. So our objectives today, we're going to start off with a little bit of background. Lisa's going to share the creation of our organization Impact that was really created at the beginning of the pandemic. The organization was focused on creating and amplifying public health messaging during the ongoing pandemic. Then we'll shift to discuss a little bit about the lessons we learned as an organization, grassroots kind of organization that became very well known nationally very quickly during the pandemic. And we'll present some ideas that can help you to showcase how health professionals can become trusted messengers, as well as highlight why it's so important that health professionals are engaged in this fight against misinformation. And then we'll close out with Dr. Bloomgarden discussing a model for how others can utilize the model that we've created and the recipe we've created to engage communities and combat health misinformation within your own organizations and institutions. So with that, I'm going to hand it over to Lisa to kick us off.
Thanks, Shikha. So in 2021, the Surgeon General declared misinformation as a public health crisis and called on health professionals and healthcare organizations to proactively engage with patients and the public on health misinformation, as well as to use technology and media with platforms to share accurate health information. However, many healthcare professionals are not accurately trained in the nuances of fighting misinformation or the technology platforms to address medical misinformation. Additionally, there are a lot of risks that medical professionals who engage in advocacy around medical misinformation on social media face. So, for example, this is a study from our co-founders, Dr. Vineet Arora and Dr. Shikha Jain, on harassment on physicians who participate in advocacy on social media. Ironically, it was actually done before the pandemic, but was published after the pandemic. but they found that 1 in 4 physicians report being attacked on social media, and 1 of 6 female physicians report being sexually harassed on social media. So the most common reason for cyberbullying they found was advocacy. And number 1 within that category was advocating for vaccines specifically. So with this issue, it can be very difficult to encourage healthcare professionals to advocate when they may not feel safe. Not only we have identified that, but other organizations have as well, such as This Is Our Shot, who's actually one of our partners. They've identified the need to address the issues of harassment online. And part of the reason we've created the impact strategy and done the things that we've done in the way that we've done is because of this. So medical misinformation, specifically vaccine hesitancy, is not a new idea. On the left here, we have a cartoon from the 1800s titled, "Better Not Vaccinate Than Vaccinate with Impure Virus of Cowpox." And on the right is an 1802 cartoon entitled "The Cowpox, or the Wonderful Effects of the New Inoculation." And it depicts a very startled crowd with like receiving vaccines and almost morphing into cows. So it's pretty obvious that although vaccine hesitancy has been a really constant thing recently, it's not new and it's been around for a while. Additionally, the idea of misinformation in healthcare is also not new. This is a paper also from Dr. Arora, also accepted before the pandemic, ironically, and it addresses the misinformation and how misinformation can affect the clinician-patient relationship. In here, we can outline a couple of key types of misinformation. One of them is pseudoscience, which is misinformation due to unscientific claims. Another is junk science, which is claims based on fraudulent or disproven data. So fear of vaccines causing autism is an example. Outdated science is due to the incremental nature of science. Information is now outdated or has been revised. So a great example of that is the whole masking controversy that happened at the beginning of the pandemic. Inappropriately applied science is misinformation due to clinical heterogeneity that renders science not relevant to a clinical context. And finally, conflicting interpretations, which is misinformation due to conflicts in 2 or more established guidelines. So an example of that may be the US having different guidelines than the UK during the pandemic. So misinformation is not new, but it is getting worse, and healthcare professionals have a really important role to play here. So I think it's really important to first consider some basics. So why and how did misinformation spread so fast during the pandemic? And a key concept is the idea of intent. So misinformation is information that is misleading, inaccurate, or untrue based on currently available evidence, and the decision to specifically share this information may not be done with malicious intent. Whereas disinformation is a category of misinformation that is deliberately created and shared with the intent to deceive, typically for some kind of personal, financial, or political gain. The purpose of disseminating this information is to achieve some secondary gain that often doesn't benefit a target audience. So it can be very common for disinformation to be established by someone and then it to be even further shared as misinformation, not without malicious intent. And then if you enter social media into the picture, it makes things even a little bit worse. So this is an example of the disinformation dozen, and they were just a small group of 12 anti-vaxxers who were responsible for almost 2/3 of all anti-vaccine content circulating on social media platforms. So just shows how quickly it can spread. So then an infodemic, a term first used during the SARS outbreak and was reintroduced in February of 2020 by the WHO, is when too much information, including false or misleading information in digital and physical environments, is during a disease outbreak. So it causes confusion and risk-taking behaviors that can harm health. It also leads to mistrust in health authorities and undermines public health response. With growing digitization and expansion of social media and internet use, information can spread more rapidly, and this can help to more quickly fill information voids, but can also apply to harmful messages. Misinformation spread is often due to being so quickly due to a kind of a concept of the law of rumor from Alport and Postman. So rumors arise when there's ambiguity of the information at hand, as well as the importance of the information to an individual. So when both are very high, they kind of multiply together and it makes a rumor have greater strength. Additionally, social network and factors in. So if a group is highly connected, misinformation can spread quicker. So then when the pandemic hit, if we replace the idea of a connected social network of people with social media, we can see why the rise in misinformation during COVID-19 was so intense. During COVID, the world turned to social media for information, but unfortunately, social media algorithms and platforms drive content more so based off engagement in an algorithm rather than something being true. Therefore, purveyors of disinformation, such as the disinformation dozen mentioned before, are able to exploit social media and spread their agenda even further. However, these purveyors are not the only one that have access to social media. We, as healthcare professionals, also do, and we have an audience. Healthcare professionals are seen as trusted messengers. So this is a graph from a 2020 Gallup poll showing that healthcare professionals rate highly in Americans' assessment of honesty and ethics. And it's also really important to kind of highlight that nurses have ranked first in Americans' assessment of honesty and ethics for the past 19 years specifically. Therefore, maybe we can turn this, so what we can do is turn the problem of health misinformation online and the fact that healthcare professionals are uniquely positioned to combat the evolved science and make it into a solution that we did with Impact.
So I'm going to start here and talk a little bit about Impact. Impact was created at the beginning of the pandemic, and we took a very measured approach. Many of us had been doing work in misinformation for years. As an oncologist, I can tell you misinformation is my day-to-day. And so many of us realized at the beginning of the pandemic that there was a real need for trusted messengers. And so you can see this, the screenshot of all of us never seeing each other in person for the beginning of the pandemic. It actually took about, I think, almost a year and a half for many of us to even meet in person for the first time. Next slide, please. So let's talk about what Impact was. Impact was founded by 5 physician moms and 1 physician dad from different academic institutions across the city of Chicago. We all had a social media presence at the beginning of the pandemic, although they were all across varied platforms, but the predominant platform we used was Twitter. And what we realized was that using our combined expertise, we were able to not only expand our reach and amplify each other, but we were also able to expand our organization into multiple other areas. So at the beginning, we were 6 physicians. Now we consist of nurses, communication experts, pharmacists, people who are experts in epidemiology, health equity, and we also incorporated in some phenomenal student volunteers and student admins. Lisa has been with us since basically the beginning and is a huge reason why Impact became as successful as it was. We really tapped into our own personal expertise, but then also looked at where the gaps were. What were the things that we really needed to fill? And we partnered with those types of individuals across the state of Illinois and eventually across the country. Next slide. So what does Impact do? Our goal when we started off the organization was to strategically amplify healthcare worker voices, initially to guide local policymakers and the public during the pandemic. We were utilizing both social and traditional media for maximal effect, which we'll talk a little bit more about when we talk about our formula and our recipe. And we crowdsourced to identify gaps or find volunteers. So crowdsourcing was really a powerful form of communication at the beginning of the pandemic. If you remember, we were getting mixed messages from around the world as to how to best quarantine, how to isolate, whether masks worked, how to protect ourselves. And so we actually were very fortunate, and one of our founders, Dr. Laura Zimmerman, actually runs a Physician Mommy Chicago Facebook group. So we use that group very often for crowdsourcing to see where gaps were within the state of Illinois. And then we also partnered with all of these other organizations, such as the Illinois State Medical Society, the University Blood Initiative, a new organization that started at the same time as us, Get Me PPE Chicago, that was started by medical students and was identifying areas across the state that didn't have PPE, so nursing homes and high-risk areas. All of these different partnerships, we really work towards amplifying all of their initiatives, and they amplified our initiatives. And that, I think, is the secret sauce for what we were able to do. We partnered with organizations that really needed our help, and we were able to amplify them and also amplify our own work at the same time. We were also able to create, as I said, a recipe for kind of crafting and disseminating our message. And the most important thing that we did was we would take on a specific issue and we would repurpose and repackage the information to utilize a kind of cascade effect. One great example of that would be when, for example, Get Me PPE identified nursing homes as a very vulnerable area and an area that needed PPE. We went to our Facebook group and we posted for people to donate PPE there. We would ask people if they were seeing other areas that were in need, and then we will funnel all of that information to the Get Me PPE Chicago group. And basically through crowdsourcing, we were able to get hundreds of thousands of gowns and masks and hand sanitizer and other resources across the state and eventually across the Midwest. Next slide, please. So tackling misinformation, this is one of the biggest things that we do is impact, and I'm really proud of the work we've been able to do. We use innovative ways to tackle misinformation, and I think the most important thing that we realized early on is we need to really reach people where they are. So people get information in different ways. Some people get information from newspapers. Some people get information from the TV. Some people get information online. We partnered with Bump Club, which is a national organization to talk to mothers. And these are community members across the world, really, who access the Facebook Lives that we did with that organization. Again, targeting specific topics based on what was the most needed aspect of the day. Let's talk a little bit about our infographic series. So we've created over 80 infographics since we launched, and we took a format that was adapted from climate scientists in their debunking handbook in 2020. These infographics that we utilized really had thousands to hundreds of thousands of shares, impressions, engagements. We were even able to print out some of these infographics and create handbooks that were available at live events, and that were also distributed in doctors' offices across the state. The infographics that we created were utilized by both the Society of Hospital Medicine and Chicago Public Libraries. And we've been able to see our infographics disseminated on TV news, in newspapers, and most recently in a book chapter where we outlined our recipe for success in combating misinformation. We published academic papers as well on the topic, as you can see here, a coordinated strategy to develop and distribute infographics addressing vaccine hesitancy and misinformation. And interestingly enough, as it is in this day and age, many of our infographics were picked up by Popular News. As you can see here on the right side, Nicki Minaj had actually been talking about COVID-19 vaccine claims, and Dr. Aurora was mentioned, and so she was able to use our infographic to live action debunk misinformation in conversations that were happening around this article. Next slide, please. So I think it's really important that we emphasize the fact that advocacy efforts are not just going to the Hill and lobbying and doing what's traditionally seen as advocacy. We as an organization use really unique and innovative ways to incorporate advocacy into our misinformation campaigns. We did deliver over 13 policy level letters focused on different topics. So everything from a shelter-in-place order to healthcare worker, personal protective equipment, universal masking, vaccination. And these petitions and letters that we sent to our local government leaders garnered thousands of signatures from healthcare workers. Again, we utilize social media to really garner support for these types of initiatives. We would go to our Facebook groups, both with the Physician Mommy Chicago group, as well as our partners such as Vaccine Hunters and other Facebook groups, and ask, what are the needs? What is the concern? What are you seeing right now? We would draft a letter accordingly to where the gaps needed to be filled. And then we would post the letter asking people for signatures before we sent it to our local leaders. And we were able to see real-time impact of our advocacy efforts from the traditional sense of an advocacy letter would be sent, and we would see at a press conference discussion of the letter, how many people signed, and what steps were going to be taken in order to address our concerns. You can see in the picture in the top right, Dr. Ali Khan, another one of our founders, speaking at one of the City of Chicago press conferences. We published over 50 op-eds on COVID-19 in high-impact news outlets and contributed to over 200 local and national news features. This gets back to reaching people where they are. Again, advocacy efforts are really important, but you need to be really strategic in how you're engaging in this advocacy. One of the things that we learned early on with Impact is we needed to figure out what exactly we were trying to accomplish and then figure out the best avenue for that. Would it make sense to send a letter to the governor, or would it make sense to put out a petition? Would it make sense to go on the local news and talk about an issue to get to the community, or would it make sense to write an op-ed or a letter to the editor in the Chicago Tribune? So really thinking strategically about what your goal is, what outcome you want to achieve, and then what tools you can utilize in order to have the biggest impact of your advocacy efforts. Next slide, please. So we created an advocacy toolkit that helps to address how to attack and address misinformation on our website, which you can access on our Impact 4HC website. And this toolkit has been utilized by other organizations across the nation at this point. So happy for you to check it out and utilize it for your own organization. Next slide, please. So again, this goes back to what I was saying a few slides ago, how important it is to select an advocacy tool. And I want to emphasize here that, again, advocacy tools are not just what you traditionally think of advocacy. It does not mean you have to write a letter to your governor or a statement. It doesn't mean that you have to lobby at the Capitol. There's a lot of different ways to combat misinformation and advocate for evidence-based messaging and advocate for evidence-based initiatives. So different formats that we found worked really well were letters to the governor, op-eds, the infographics I mentioned, petitions, blog posts, Facebook live chat. So utilizing social media to really emphasize our topics and our messaging, I think was really important. And again, we used kind of a cascade effect, which I will talk about in one of the upcoming slides. Next slide, please. So this is some examples of some of our infographics that we've created. We're really proud of these. And I have to say, these were actually championed by our students. So our student interns are the ones who really created the infographics with the guidance of the leadership within Impact. And I want to emphasize one thing here that I think is incredibly important. We learned a lot from our students throughout this time because our students have a finger on the pulse of how to reach the younger generation, which I've recently been told I'm no longer a part of the younger generation. So learning from our students was really, really helpful because the students were not only able to tell us how to reach their generation, but also how to reach their communities, how to reach colleges, how to reach people who may be able to get the messaging out to different communities that we might not have access to. Our infographics are very simple to read. As you can see, they don't have a lot of verbiage on them. We make sure that the health literacy is taken into account, and depending on what the topic is and who we're trying to target, we want to make sure that it's easy to read, easy to understand, and easy to distribute as well. Some of our highest impact infographics early on had, as I said, hundreds of thousands of impressions, and we would share them across multiple social media platforms like Twitter, Facebook, and Instagram. Next slide, please. One of our most well-received and effective and impactful infographic series was our myth debunking series. So we would create a series based on whatever crowdsourced off social media myths we were seeing, whether it was what we were seeing ourselves or what our colleagues were seeing or what community members were seeing. I think that one of the things that was really powerful for this particular series was we not only went to healthcare professionals, we also went to the community. So we went to, for example, the Vaccine Hunter Facebook group and would ask, what are you seeing as concerns? What misinformation are you seeing? And then we would address our infographics accordingly. Anytime you're trying to debunk information online, it's incredibly important that you start with a fact. It's been proven time and time again, and it's been studied that if you start off with the misinformation or with the myth, it's more likely that people will remember that information. So I think it's really important to remember, start with a fact, state the truth first, then you can explain the myth and why, and point to that as a myth and misinformation. And then you can focus on describing and explaining why the misinformation is false. So it's kind of sandwiching the lie between two truths. And this was one that we did at the beginning, talking about infertility and vaccines. And I saw a question pop up, what type of programming did we use? We predominantly use Canva. We did use Venngage as well, but we found that Canva is really easy to utilize in creating these types of infographics. Next slide, please. So the amazing thing about our efforts throughout the pandemic is we were able to see how our social media and traditional media advocacy efforts were actually able to lead to real world impact. So we created, when the vaccines first came out, we created a vaccine clearinghouse. The first thing we realized was healthcare workers who were not associated with large academic institutions were having trouble getting the vaccine. So initially, our vaccine clearinghouse was dedicated to those healthcare workers who were not able to get vaccinated. And we were able to get thousands of healthcare workers vaccinated by providing resources and partnering with Oak Street Health here in Illinois, who basically were able to get thousands of people vaccinated who learned from our vaccine clearinghouse from social media where they could go to get vaccines. When vaccines became available to people who are not in healthcare, we updated our vaccine clearinghouse almost hourly, sometimes even by the minute, with tips and tricks as to where you could get a vaccine, how you could register, when new vaccine appointments were going to be dropping. One of the biggest things we saw in Illinois and across the country was disparities in vaccine distribution, because a lot of people can't take off time during the day to go get a vaccine. The most vulnerable communities may not have access to Wi-Fi or internet or broadband. So we were able to not only create this online social media effort and create a vaccine clearinghouse that was updated regularly, we also were able to print out our infographic and have it distributed in some of the more higher risk areas. So people in their churches or going to their local physician who may not know how to get a vaccine were able to access that information through our flyers and our infographics, as well as our vaccine clearinghouse. And again, we partnered with Facebook groups such as Chicago Vaccine Hunters and put that information in those groups. And they were able to provide us information. So they would be posting in the group, just so you know, Walgreens is opening up a slot at noon today. And we were able to put that into our vaccine clearinghouse, which was able to get thousands of people vaccinated. So we saw a real world effect. Next slide. And as you can see here, through the Vaccine Clearinghouse, we were actually able to organize numerous vaccine events. Two really important people in this slide, Dr. Hala Akbarnia in the yellow and Dr. Eve Bloomgarden. Dr. Hala Akbarnia is also on the far right, wearing that green shirt, doing the thumbs up. She single-handedly, I would say, probably coordinated over 700 or over 1,000 volunteers and registered thousands of people to get vaccines and created vaccine events. And again, this is all utilizing our online social media presence and garnering information, finding out where the holes were, where the vaccine events were needed, setting up those vaccine events, and then disseminating the information on social media and traditional media. And then at the events themselves, those infographics that we created for online, we actually also printed them out and had them available to address misinformation and questions that people had at these vaccine events. We also had our infographics translated into Spanish as well, which I think was really important, making sure that our information was accessible. And we had partnered with food depositories, food banks, with churches, and were able to get a lot of people in those really vulnerable areas vaccinated, utilizing our social media campaigns, which was really great to see our advocacy efforts and our misinformation efforts translate into real world impacts. And many people who volunteered at these vaccine events actually had people come up to them and tell us that they had seen our misinformation infographics online. They were hesitant about getting the vaccine, and they changed their mind when they visited some of our information. So really an amazing thing to see our impact in real time. Next slide, please. So let's talk about the recipe. The recipe for success that we discovered. There are two really big components. One is repurposing any content that's created, and two is disseminating and amplifying via social media, not only our own efforts, but our partners' efforts. So let's first talk a little bit about repurposing content. So the best way I can describe this is we would take whatever the most important topic at the time was. So for example, masking. If masking was the biggest issue, especially at the beginning of the pandemic, we would start off with, all right, let's create infographics related to masking. Whether it was misinformation on masking, whether it was just understanding why masks work. We created some amazing infographics on staying 6 feet apart, not under. We then would utilize that same infographic and the data from that and the information from that, and we actually would create a blog post. And so that blog post would go into more details specifically related to the infographic. And then we would create a Facebook Live, or a YouTube video. So if people get their information through videos, we would have that available to them through videos. Some innovative things we did when we created 6 feet apart, not under, we actually created a song. And so that song we put on YouTube, and we actually got the song picked up by our local news media. So the next thing you would do is we would say, okay, who are we missing? We went on Facebook Bump Club Lives, and the same exact topic that we were using for our infographics, for our blog post, for our impactful chat, we would now take it to the moms. So Bump Club and Beyond did a great deal of work with us addressing misinformation using their Facebook Live chats. Then we would pitch it to the local news media. So our infographics and our op-eds were featured in local news media. And then we would write an op-ed. So again, it's taking the exact same information and putting it out there in as many possible ways as possible, because you don't know if people get their information from the TV news, from the newspaper, from YouTube, from social media. So we tried to be very consistent in our messaging and target as many different avenues as we could. So that's repurposing the content. Then the biggest part, I think, that made us the most successful was our partners. So our partners would share with us things that they were working on, and we would share with them things that we were working on. And then we would amplify the work they were doing, and we would amplify the work we were doing. And again, we tried to keep it again in the same kind of repurposing the same type of content. So it would be one week we'd be focusing on one topic, another week we may need to focus on vaccine hesitancy. But we really look to see in the news media and through our crowdsourcing through social media, where were the gaps and what needed to be focused on in the moment. And next slide, please. So again, the biggest takeaway from this is you need to figure out how to repurpose your content and then amplify. The thing that I think we did a lot at the beginning of the pandemic was very reactionary, because information was being poured at us and thrown at us so fast that we had to be very reactionary. We had to do all of these things kind of in a very fast way. We had a rapid response team. Now we've got the benefit of having a little bit more time, and a lot of the public health crises are ongoing or have been going on for years. And so we can also incorporate in things like academic publications, presentations, and get this information out again in multiple different ways. So repurposing the content, I think, is very important, getting that information to multiple different areas. When we talk about amplifying our partners, when we did that through social media by not only posting on our social media accounts, asking team members to share it on their own accounts, quote tweeting and tagging others, using the hashtags that we knew had the highest reach. We created some of our own hashtags, like 6 feet apart, not under, that ended up having a very large reach because we created a song that went along with it. Tagging partners and organizations and other relevant organizations that are really going to be engaged in what you're working on. Liking and replying to all positive comments. I recommend maybe commenting once or twice on negative comments or trolls, just to put the information out there. But we really worked on not engaging with the trolls, because engaging with the trolls, as you all know, can be very exhausting and can also lead to negative interactions. So what I suggest to people is, if somebody says something negative on one of your tweets or one of your posts, I usually thank them for responding. I will give them some factual, evidence-based information in response, and usually put in an article in there. And I'm not doing that to really change the mind of the person who's attacking us. I'm really using it as a way to bring other people to understand that our information is based on science and evidence. So it's really about those people who sit on the fence, who might read the troll comment and wonder if they're actually presenting accurate information. So that's one way to engage and to amplify as well. And then bumping posts of team members. So especially on Facebook, if you're in a Facebook group, putting bump actually increases the algorithmic availability of these types of posts. So that's really how we repurpose the content and amplified other people's work. And then Dr. Bloomgarden is going to talk in a little bit about how we amplify each other's work as well with our Twitter amplifiers. Next slide. So with that, I'm going to hand the microphone over to Dr. Bloomgarden to take us home.
All right. It is so lovely to be here. And also, it is amazing to hear all of the things that we did. And, you know, after blocking out the last few years for various reasons, it's cool to remember them. And my children still sing our 6 feet apart and under song. They loved that song. Okay, so we did all of this work, and we're going to kind of talk about how we divide up the history, the present, and the future of impact. But, you know, we spent the last 12 months or so publishing the message within the healthcare space or within the science communication space. I might sing it for you. Maybe we'll find the link for you. We've also been able to move into new spaces that naturally flow based on the formula that we came up with and that we're going to address. And this is just kind of an overview of various things that we were able to do through the healthcare world, using podcasts, op-eds in the Washington Post, the New England Journal articles, as well as the AAMC. Next slide, please. And a key component of the success of this work was something that we did in the background of social media. So we really relied heavily on what we call the amplifier, which is a group text thread that is embedded into Twitter. And we had an impact amplifier there that I would say at the peak was maybe 50 people. And it really was a way for us to rapidly communicate in real time in order to have a coordinated response, reaction, and to do a pulse check or a temperature check of what we're thinking about something if we hear something. And also we had accumulated various experts that were involved on the back-facing side of impact, who we needed to recruit and to weigh in on various different things that arose during the pandemic and have arisen, as we move out of the COVID world. And it was really an experience for us to have this access and this constant conversation because it allowed for us to respond in real time on social media and off social media, and it kept our message really consistent. And so here's our JMIR article on the use of Twitter amplifiers by medical professionals to combat misinformation during the COVID-19 pandemic. I would say this in and of itself was one of our most critical communication strategies. And next slide, please. And here we actually decided to pivot back to academia and our healthcare space to publish what we call our formula. And this is at the very beginning of the pandemic, I would say March 13th, 2020, when we were all kind of panicking online and we didn't know each other well yet. We started really trying to figure out, what do we do? How do we communicate the science that's coming in from Europe, that's coming in from China, that we're hearing in our medical circles? How do we pivot and discuss with our communities and have the biggest impact? And so instead of taking a national approach, and trying to get federal policy changes, we thought our biggest impact would be if we stayed local. And so what we really did was a place-based approach to making an impact using a virtual or social media predominant strategy during a time of lockdown. And so we describe how we did this and how we were so effective by working within our own networks and using our own political clout and connections, as well as connections made during that time of crisis, in order to really keep the Illinois Chicagoland area safe and knowledgeable and on the evidence-based side of science information that was coming out to the best that we could. Next slide, please. And a key to all of this is we're educating the next generation. And I feel so old when I say that sentence, but it's true. We wrote an article for the New England Journal of Medicine on what was needed in order for us to be able to respond to the Surgeon General's call for healthcare workers to engage in combating misinformation and countering misinformation. And so we have been doing that, but what we really pointed out, and I think we were one of the first ones to do so, was that we don't have any training in this and it's not part of medical education. And so we needed to incorporate that. We also were unsupported in terms of the vitriol that was coming our way. And it comes, we see every day in social media in particular, but also that was in real time in person. And so we needed support for those people who were being attacked or doxxed or slandered, online. And then we really needed some sort of organized way to fight disinformation at its source. So kind of this 3-tiered call from us to the healthcare space, saying this is what's needed for us to be able to answer the Surgeon General's call and really stay engaged in this space. Next slide, please. So then in 2020, if we're going to name years by a word or so, 2020 for us was a year of action. It was a bit frenetic. We just kind of were whack-a-moling, what was coming out, what we're hearing, it was very, very go, go, go. So we gathered a lot of data. We did a lot of trial and error and testing. We had a lot of communication with people who had expertise within the spaces of science communication and epidemiology and infectious disease, and made sure that we were accurate. And we gained a lot of real world critical experience. 2021 to 2022, which we'll call like the world's longest year, we learned a lot, and we really were able to hone in our reputation as a credible source of information and as a connector in the SciComm space. And that was evidenced by invitations for national and international talks. I think we gave a talk here in 2021. So in that year of credible information and other, both local, regionally, and also across the country. Now in 2023 and beyond, we're sharing our experience with others. We've published our stories, we've created toolkits that we're resharing and making sure are up to date. We have kind of perfected or at least perfected the way that we present our impact model, and we have our websites and our publications available to share. And so at this point, I could say we know how to use our formula for success to amplify voices and address misinformation. And we are excited that you will join us. So tag us when you're doing the same. Let me tell you a little bit about where we've gone since. So next slide, please. So it turns out that physicians are really at the center of multiple overlapping, intersecting public health emergencies and things that I would say have really come to the forefront over the last year or so, but had been on our minds, and we've all been active in this space already. So firearm injuries, we're going to come back to this, but one of the things that has been the most tragic is the number of injuries and deaths and damage done by gun violence. And so we have a lot of effort in that space right now. Countering misinformation and rebuilding trust as it continues to erode within the healthcare community, as healthcare, the system is, a little bit broken right now. It's an understatement. It's broken and we are burnt out, and there's a lot that we are trying to do to maintain and to rebuild and to regain trust in vaccines, not COVID vaccines per se, but all vaccines, in gender equity and reproductive health care and gender affirming care. We have the policy side of things with telemedicine and prior authorizations. And again, the struggle of workforce shortage, burnout, and the list is endless. But luckily our formula works for many of these things. Next slide. So what we've done in the gun violence space, I'm going to give credit to our impact, I think she's chief of community outreach, but really she's our superstar, Dr. Hala Akbarnia, who is someone who was very, very active already in the gun violence prevention space, and she is an ER doctor, but she has really taken the lead as the impact gun violence prevention liaison, as someone with personal and professional expertise in this area. The reason why we're so invested in this space is every day, 321 people are shot in the United States. So that includes 111 people who are killed, 210 who are survived their gunshot injuries, 95 who are intentionally shot by someone else, 42 who are murdered, 65 from gun suicide, and the list goes on and on and on. And we know that firearm injuries are the #1 cause of death in children, surpassing every other cause as of 2020, and that is going up. We also our local community includes Chicago, which has really high gun violence on a daily basis, and in Highland Park Hospital, which is around the corner from us right here. And so we had a lot of secondary trauma, a lot of primary trauma. There's just a lot happening in this space that we felt like we really needed to get involved in. So what we do is we participate and partner with other organizations using our formula. We have been able to partner to do virtual discussions, to hold to have resources available for the community, and we have a constantly updated resource page here that is available to all. Next slide, please. Okay, and I'm going to just be really fast here. This is just an emphasis. Here's Dr. Akbarnia speaking out about gun violence prevention. Next slide. We've also made statements on the overturning of Roe versus Wade, and this is our letter to Governor Pritzker about urging safe harbor protections for patients and for abortion providers after June 2022, so that we knew people were coming into Illinois on both sides of the equation, and needed to be able to protect people coming across our borders. Next slide. And this is just a talk that I'd given to OBGYN in order that really reemphasized what's going on in Illinois right now. The Illinois here is in blue. You can see that we are really smack dab in the center of things. And so we were able to get some word out using our pre-established networks, and to make sure that we could support our healthcare worker colleagues as well. Next slide. So I'm going to be really, really fast here. This is just us. More evidence of us sharing beyond the pandemic and sharing our impact knowledge. Next slide. We've been able to use our infographic talents in order to just raise awareness about healthcare issues, to support various enterprises, and to get involved in other infectious disease topics du jour. Next slide. Like monkeypox. Next slide. And recently, Dr. Jane was invited to be part of this committee on how to create a global impact for engaging in trusted scientific information and to counter misinformation. And this is through the National Academies of Science, Engineering, and Medicine and Impact. And our Impact team, mostly students and our lead, Dr. Tejal Shah, have been working really diligently to provide new updated infographics on understanding mis and disinformation and on addressing this call. Next slide. Lessons learned, I think we can all say many, but physician voices are really trusted, so we need to know how to use them. Social media is a double-edged sword, but it is a tool and it can be very effective in crowdsourcing and in disseminating critical information. And community partnerships are key to success here. Next slide. And again, we covered this already. Next slide. So probably one of the coolest things that's happened was that we were featured in Time Magazine, along with many of our partner organizations and those nerdy girls at Dear Pandemic, for example. And we got to show our parents. So that was really cool. And really what this really highlights is that it was our inner, all of our various hats that we wear on a day-to-day basis overlapping, allowing us to be in the right space at the right time to take on this work. Next slide. So get involved. Please tag us on social media. Please reach out with questions. We're excited to hear from you. And we have a couple of minutes, I think, left for questions. And if we go just to the last slide and then we can come back here. I just want to show off our team. This was one of the iterations of our team. It's growing and expanding all the time as people come and go. But it's a really, really awesome team. And oh, hi, Amanda. We'll go back. We'll end on our social media links page, just so if anybody wants to jot that down. And we are open for questions.
And I want to emphasize a point that Dr. Bloomgarden made, which is the formula that we utilize throughout the COVID pandemic is what we're utilizing for all of those other topics that she talked about, whether it was gun violence or reproductive health. And so the formula works and the formula can be repurposed for really any topic. And I think that's incredibly important for anyone who's listening today, that we have resources for you if you're interested. So let's go to the Q&A. So the first question I'm going to put to Dr. Bloomgarden. Unfortunately, I have read and seen on social media nurses and other healthcare professionals spreading misinformation around COVID and vaccines during the pandemic. What was your experience with this and how did you address it in your community? So if you can address that, we've got about 13 minutes, I think, for questions. So, and I think we've got 4 or 5 questions in the chat.
Okay, I can talk very fast. So yes, this is a huge issue. There's a very, very small number of healthcare professionals who have done a ton of damage in terms of lowering trust in healthcare and in medicine and science in general. And we have done a variety of things as this situation evolves. So in July of 2021, I myself, along with 3 other physicians, wrote an op-ed for the Washington Post, basically calling out this situation and calling on the FSMB, who is the Federation of State Medical Boards, to actually follow up with their statement that people will be held accountable and to put some action into, or words into action here. And we've really not seen a ton of activity here. There's a lot of reasons for that, but it is something that we need to continue to push on our legal colleagues and our medical boards to demand accountability for people who are intentionally generating and spreading hate for secondary gain. In California, AB 2098 did pass, which was the holding accountable, holding them physicians accountable for the spreading of misinformation. But now, of course, it's in a lawsuit due to one of the physicians who is benefiting from this. So there's a lot that goes there, that goes into this. But yes, it's an ongoing, evolving situation that we are all too aware of, and we would be more aggressive about it if we weren't also, afraid of the backlash, which has unfortunately been happening to many people who are in the spotlight trying to counter this. Okay.
And I will, great, amazing answer, Dr. Bloomgarden. And I would add that the challenge is, and this has been the challenge with misinformation in general, is we talked about the disinformation dozen, that there's a small group of people who are able to amplify misinformation very rapidly because of their resources. So with things like our amplifier, we've tried to combat that using similar strategies to what they use. Unfortunately, there's always going to be people out there doing this for personal gain. And I think when we get to the point that we have to emphasize the fact that we are doing this in our free time and not for money, we're doing it without any secondary gain. I think that also also helps to improve our standing and the trust that we have. The next question is if there was any collaboration between Impact and local public health departments or the state public health department. So I can touch on that briefly. Yes, there absolutely was. We worked with the public health department as well as with places like the Illinois State Medical Society, the Chicago Medical Society. We were in communication pretty regularly with them in an unofficial capacity. We would be texting, we would be doing a lot of backdoor discussions. We were getting input as to who we needed to contact and when, and we were really kind of streamlining the information from the rest of the community to the public health department, again, in both unofficial and official capacities. So the official capacities we through letters, the unofficial capacities were us having relationships with those individuals. We actually, our congressman was actually incredibly useful. We would text him when there was something happening that we were all panicking about and saying, hey, this is not being addressed. Our hospitals are completely like overwhelmed and it seems like no one knows. So we would text him and say, this is the issue. And he would say, okay, if you can write a letter or do this and get it to my office, then we can take the next step. So we did work very closely with not only the public health offices, but also with our local government agencies.
And we continue to do that in terms of in the gun violence space and in the reproductive health space as well, using those established channels. So that we make sure that we have the right, that we're having the least amount of effort for the most amount of impact, because we all have busy lives as well. And so our relationships that we've established have really continued to pay themselves forward. I really want to address this librarian question because I really like this. I'm happy to read the question, but or answer it, or I don't know if Shika or Lisa is, but the short answer is yes, we love working with academic and medical librarians.
Before you answer it, let me read the question so people know what it is. So the question that came in was, do you work with any medical academic libraries? If not, I'd highly advocate for it. And this is coming from an individual who's a medical education librarian. So Dr. Bloomgarden, if you can talk a little bit about how we did partner with librarians and libraries and what exactly we did.
Sure. So I'm going to give a shout out to a talk that's coming up in, I think, an hour or two in this exact auditorium that is from Dr. Vinny Aurora and Sarah Saratelli and some of our medical librarians as well at University of Chicago. We initially, as part of Impact, we partnered with Chicago Public Libraries in order to disseminate information and infographics, and also to have a resource for being the experts on information procurement and translation. So yes, we did work closely with librarians, and also through our various health institutes, we were able to not only use them as a resource or use you as a resource, but we have a medical education course that we've been teaching at University of Chicago for the last few years that multiple sessions of that course are taught by our librarians. So absolutely. And I think it's an underutilized partnership that we are excited that we have been able to benefit from.
And Josephine, I know you mentioned you might be interested in getting involved. Please feel free to reach out to us. We'd love to work with you if this is a space that you're interested in. As we talked about, initially Impact was place-based, but we have partnered with so many organizations around the country and so many individuals across the country that we always love meeting new people who are interested in doing similar work. So if you'd like to reach out to us, please feel free.
And then the final question, I think, is about the platforms, right? So did you find one platform to be better for civilized discourse? I'm going to have Lisa weigh in on this if she's up to it. And then if you could only choose one platform, which one would you choose?
I personally feel like Twitter, we were super successful in general to like reach more people. But I think in terms of the most impact, it might have been Facebook, because we were able to reach a lot of moms, like plug in through the different groups and things like that, and Chicago Vaccine Hunters, Vision Mommy Chicago, and like crowdsource a ton of information there. I don't know if you guys have a different response, if you guys think Twitter or Facebook, but probably one of those two. I think if we had to pick one, maybe Twitter, because it had the furthest reach.
So I would say I agree. I think that obviously with Twitter being under new ownership now, we're not sure what is going to happen and how the engagement is going to be on Twitter in the next iteration of it. But I would say it was different platforms for different needs, right? So Facebook, I think the biggest impact we had with Facebook was we were able to crowdsource really well there. We were able to targeted crowdsource as well. So specific locations, specific groups of people like the Physician Mommy Chicago group or the Vaccine Hunter group. So I think we were able to use Facebook for a lot of that. The other thing is dissemination of our messaging. I was able to get messaging out to people who have known me for my entire life, but I haven't talked to since I was in high school or middle school. I had preschool teachers emailing me saying they saw the posts that I was putting on Facebook. So I think that you're absolutely right. We were able to reach a very different audience. Twitter, I think, was a really huge place for us academically and in the healthcare space. So Twitter was a really great place for us to get information and also to engage with other healthcare professionals. It was a great way to disseminate information as well. Twitter, as Dr. Bloomgarden just said, Twitter was huge for journalistic collaboration. So when we were getting quoted in, CNN or in the New York Times, it was because usually a journalist found a tweet of ours on Twitter. I was quoted in some random golf journal at one point, which I haven't golfed since I was 14, but it was pretty cool. And they found a tweet that I had. The Nicki Minaj tweet that Dr. Aurora put out, that ended up on in a, I don't remember what publication, but maybe the Huffington Post or something like that. So I think it really depends what you're looking for. The other thing that I think is important is videos. So video content, short videos are usually the highest engagement across all social media platforms. So that's really important as well. But again, brand recognition and using the same content across platforms, like Dr. Bloomgarden just said, that waterfall effect with our recipe worked really, really well. And I think we have time for one more question, if anybody else has another question to ask. Because Dr. Bloomgarden did such a great job of talking so fast.
I mean, I could go faster.
And if anyone's interested, I did post the link to our YouTube song, 6 Feet Apart, Not Under, where you will hear both myself and Dr. Bloomgarden, and I think some of our children singing in
our children. And the song was written by Dr. Mylan Martinez, who's an amazing musician and an amazing physician as well.
Dr. Bloomgarden, you're being asked, we've got 4 minutes left. You're gonna have to sing the song.
Okay. I can't remember it. No, I can't.
Okay, I'll sing it. Ready?
Okay, yeah.
I'll sing it with you. It's stay inside.
I'll let you do it.
On your own side.
This song I sung her 6 feet apart, not under.
It's been a long time since we've heard it.
Well, I don't even know what I had for breakfast, but I remember the song from 2020.
Definitely check out the YouTube link. It's quite an entertaining clip, and it's only about 1.5 minutes. So, and the other thing that I think is really cool that we were able to do with all these connections, we were able to take pictures of our children getting vaccinated, and our kids were so proud to show off their little vaccine stickers. My daughter had her picture on the local news showing that she was one of the kids who got vaccinated. So, we were able to get our families involved as well, which I think was really important because, as we all know, something that we didn't talk about too much on this, but there was a lot of burnout amongst the healthcare professionals. So we also tried to focus on not just the advocacy efforts and all the work, but also trying to make it fun if we could to keep ourselves engaged. We created these amazing vaccine certificates for kids when the vaccine came out for them, and we had people print them out and highlighted them on our social media when they had an impact vaccine certificate. So I think that while this work is really important and combating misinformation is an incredibly important thing for us to be doing, and it's super important for us to be focused on, we also were really focused on making sure that we tried to keep our heads about us and created this amazing community of other healthcare workers who supported us. And I think that community that we built over the last 3 years has been really important for our ability to continue doing this work, because without it, I think we all would have burned out.
I've typed an answer to the last and final question, which is how do you fund all of this work? And we don't really fund all this work. Most of this is volunteer. We are 501c3 nonprofit organization. If anybody wants to, contribute, but we were able to get a lot of, of the tech as part of a nonprofit, as complimentary. And then we have small amounts of funds to pay some administrative assistance and for our summer student interns, for example. But a lot of it remains unfunded. And so it's a labor of love. And maybe we'll pivot one day to change that. But for now, it's just what we do.
And we did apply for some small grants that we were able to get. So that was very helpful. And I think one thing that I've been able to do with my job is I've incorporated it into a part of my professional development and what I do for my career. So I think if this is something that you're interested in doing, if you're in a position to discuss with the higher ups in your institution, whether this can be something that could be a part of your job description, because public health messaging is important for all healthcare workers. That's another possibility to help get this funded. But yeah, we are largely volunteer driven. Wonderful. Well, we made it right to time. Thank you so much for joining us today. It was lovely to engage with all of you and some really phenomenal questions today. So thank you so much for joining us, and feel free to reach out to us on social media anytime.
Oh,
Stay
and a
safe
big
and
round
well.
of a big round of applause to all of you. Oh, that was fantastic. I'm so inspired, and I really appreciate you sharing your recipe. So we've got our two major steps here to follow. Awesome. I just want to quickly say to everybody who's attending that we do have continuing education credits available for this session. You'll receive an email after the symposium ends with a questionnaire and instructions on how to claim that. This is available for CHESS and for MLA and CPH CE. And we've just got about 30 minutes or so to the next session that will begin at 3 p.m. Eastern time. So we'll welcome you back then. And I encourage you to check out NNLM membership if your organization is not already a part of our membership. Lastly, if you've been enjoying this conversation, we do have an ongoing series of health misinformation webinars that will be happening with additional expert guest speakers. There'll be hour-long sessions, and they'll be taking place intermittently throughout the rest of the year. And you can check out upcoming sessions on the NNLM training calendar. So thanks to everyone for attending, and thank you again to our presenters. Wonderful. Have a good rest of your afternoon.